Thank you for giving me the floor. My name is Bengt van Loosdrecht. I am the Dutch ambassador since last August to Sweden. I think the timing of these meetings is really good, as there is increasing pressure on healthcare systems in the world, in Europe, of course, and we have a way now together to look at ways to ease that pressure. So thank you for bringing together all these parties. Actually, the Netherlands, Switzerland, and Forum for Healthcare is organizing this. It's good to bring together those parties who deal with health policy, and especially now with healthcare. The goal of the webinars is to learn from each other, to look at best practices with a view to not reinventing the wheel, as we can learn a lot from each other's experiences. This embassy has helped to bring together parties in the past, those parties who otherwise maybe wouldn't have met so quickly. I would like to commend and thank the Embassy of Switzerland for participating, and Forum for Health Policy, as they're called, for their very active role. From the Netherlands point of view, as I want to talk substance, I would like to raise a few points. The one is on what we call the Dutch Task Force for Healthcare. That's a platform in the Netherlands that deals with life sciences and health sector support. They support about 100 Dutch companies, NGOs, and knowledge institutions, healthcare providers, and governments, and they want to realize and strengthen their international ambitions, don't we all? More concretely, the partners provide innovative and sustainable solutions to healthcare challenges, and they are active all over the world. They want to broaden and strengthen their network, and the task force in the Netherlands is the first point of call for anyone who seeks Dutch life sciences and health expertise. With our approach, we want to improve the healthcare by connecting the right people. So, as a recommendation to you, do not hesitate to connect with the Task Force Healthcare, as we call it, and if needed, you can connect with them through this embassy. Then I have a few points that come through the Ministry of Health from the Netherlands. The Ministry of Health has conducted a large study on capacity development and innovation in elderly care. And I will make a few provocative propositions here. The study that was conducted in the Netherlands has found that innovation will not help significantly to relieve the pressure on health services by a growing aging population. So there is no real correlation between innovation and the help to the aging patients. The bottom line is we need humans to do the work. So I will pose a question here, and the question is, does innovation really help when what we really need is human resources? The second point is, in the Netherlands, care is being given a lot by friends and family to patients. We call it mantelzorg. That's impossible to translate, but I guess the Dutch participants will know a good word for that. Anyway, this system of help by friends and family is facing increasing pressure as the people giving care are getting older as well. So as a result, there is a tension between an increasing group of patients, because they get older, who receive care by a decreasing group of caregivers. As they get older, the group also decreases, or they become patients. So I'd like to contradict my first proposition now and say or ask, can innovation help to alleviate the dwindling number of caregivers? Can innovation do something about the number of caregivers that is declining? And then lastly, the COVID epidemic or pandemic has disrupted all the ways that we communicate. This is nothing new to you, but there's a dramatic shift from offline to online. Appointments, meetings, conversations, and orders are increasingly done online. So the final question here is, the crisis has given us new ways to remain engaged. And as a result, innovation will give us prospects for better contacts with caregivers and with non-traditional caregivers. If it is well designed, could innovation not help to improve the quality of life? These are my introductory remarks. Thank you very much for inviting me, and I wish you all a good seminar. Thank you.
Thank you very much, Bengt. Then I take the word here, if I may. My name is Claudia Fontana Tobiassen. I'm the Chargé d'Affaires ad interim at the Embassy of Switzerland in Stockholm. The Embassy of Switzerland is happy to co-organize this event on innovation in elderly care. Switzerland has a long tradition of strong global pharmaceutical and medtech companies. In fact, two of the five largest global actors in this sector, Novartis and Roche, are Swiss. The strong life science tradition in Basel, the home base for these two companies, combined with the world-renowned universities and research institutes, the ETH in Zurich and the EPFL in Lausanne, has spawned several innovative startups in health tech, bioinformatics and health services, one of which will participate in today's discussion. This is the third time that the Swiss Embassy organizes a joint event with the Embassy of the Netherlands and the Forum for Health Policy, in partnership with both countries' Chambers of Commerce, Switzerland Global Enterprise and Walker Project Scandinavia. The first event, held in September 2017, focused on the quality of the three countries' healthcare systems, which all rank among the top 10 in the world, and did an in-depth comparison between the systems, which vary from the Swedish almost fully publicly financed model to the Netherlands system, which is fully based on health insurances offered by private insurance companies. The second seminar, held in March 2018, took a view on innovation in healthcare, as seen from the policymaker's perspective, as well as the entrepreneurial perspective. What is the future of healthcare? What hinders do organizations pose? And what barriers do healthcare entrepreneurs face? What can we learn from each other? And how can we speed up innovation for the benefit of all? Today's seminar focuses on the issues facing the elderly care. While the problems have been accentuated by the corona pandemic, the underlying challenges stem from an ever-inverting population pyramid of the industrialized countries. In a series of reports last year, the think tank Timbro illuminated some of the differences in the elderly care systems that the Netherlands and Switzerland offer compared to Sweden. We hope to illuminate these differences further, once again in the spirit of what common challenges do we share and what can we learn from one another. I would like to thank all involved in the realization of this event for their contribution and all the viewers for participating. Welcome and thank you.
So I will also welcome everybody. My name is Peter Graf and I'm chairman of the Forum for Health Policy. And as we heard, we have had a lot of collaboration and good workshops previously with the Netherlands and with Switzerland. And I would really thank you for the nice collaboration that we have. And today I will welcome everybody to talk about this very important topic about innovation in elderly care. And we heard Bengt asking us good questions. How can innovation, or can innovation really improve the situation and looking forward with this big challenge globally, really? And the corona pandemic, COVID situation has of course increased the necessity of better collaboration between healthcare and elderly care. I will also take the opportunity to say that Forum for Health Policy is a think tank, independent think tank in Sweden. We want to improve healthcare, make it more efficient, things like that. And today we also publish a report, Innovation in Elderly Care, by one of our co-workers, a student from the Karolinska Institute, Nishi Dave. Very nice report. We will bring it to you, and it's good reading to look into that. when I'm not the chairman on the forum, I work. I'm the CEO of an integrated healthcare system in Norrtälje. It's the northern parts of region, the Stockholm region, where we have integrated the healthcare system really. So we have hospital, elderly homes, psychiatry, everything, home care, everything within the same organization. And my viewpoint, and I know that a lot of people in Sweden are now debating and discussing how can we make the collaboration and the interaction between the healthcare system, primary care, hospitals, and the elderly homes better and more integrated. In Sweden and the Stockholm region this spring, we had big problems. I think you all know that, with a lot of deaths in our elderly homes. And one of the issues was that the medical, the doctor participation and the nursing participation in the elderly homes, because it's divided between the municipality care side and the hospitals and the primary care where the doctors and the nurses are. We have to link it more together. And in my company, when we have everything integrated, we had much quicker and we had a better situation actually to make this integration and also prevented deaths actually. So we had much less deaths in our situation than in many other areas in the Stockholm area. And I think it illustrates we have to work more closely now going forward. We can now see that the corona situation is increasing in Europe and globally, and we have to, I think, meet better, make it more efficient. Bengt's question, I think, was very good, and I hope we get back to it. Our sort of what we have learned from this spring was also we have all these things we want to connect from the home care to the hospitals and make digital. The blood pressure, things like that. We want to see it online, but frankly, at least in our setting, when we try to do that with these fancy solutions, we have big technical problems. We can see we have big. So the issue about actually going there, listen to the heart and things like that, bedside in people's homes. We still do that because we find that the technical side is lacking, and I would like to address that topic to all of you. How can we make it more sustainable? How can we make it better? Wi-Fi and things like that, and also directly into the charts. Things like that has to, I think, improve to make it even more effective, better. Things like that. So I will stop here and just welcome you all to this interesting afternoon. So I give the word now to Katarina Backman, who is the head of the think tank Forum for Health Policy. Please, Katarina.